Good morning, everyone. Today, we are going to conduct a session on chloramphenicol antibiotic. We are making a series of videos of antibiotics. We have covered fluoroquinolones and quinolones and sulfonamides. So this is the third part of the video of the series. So let's continue with the topic. Topics that we will discuss today are introduction, the structure of chloramphenicol, the mechanism of action of chloramphenicol, bacterial resistance, antimicrobial spectrum, pharmacokinetics, adverse effects, drug interaction, and therapeutic uses. Introduction. Chloramphenicol is a broad-spectrum antibiotic. It was initially obtained from Streptomyces venezuelae in 1947. It was soon synthesized chemically, and the commercial product is now all synthetic. Even though chloramphenicol has a broad spectrum of antibacterial activity, its use is limited to only a few conditions because of its dangerous side effect, bone marrow suppression. Here you can see the structure of a chloramphenicol. Chloramphenicol is a yellowish white crystalline solid. Aqueous solution is quite stable, stands boiling, but needs protection from sunlight. The nitrobenzene moiety of chloramphenicol is probably responsible for the antibacterial activity, as well as for its intensely bitter taste. Now let's see the mechanism of action of chloramphenicol. Chloramphenicol inhibits bacterial protein synthesis by interfering with transfer of the elongated peptide chain to the newly attached amino acid tRNA at the ribosome mRNA complex. It specifically attaches to the 50S ribosome near the acceptor site and prevents peptide bond formation between the newly attached amino acid and the nascent peptide chain. At high doses, it also inhibits mitochondrial protein synthesis in mammalian cells by acting on 50S ribosomes. Now let's see the bacterial resistance to chloramphenicol. Resistance to chloramphenicol can be caused by three mechanisms. It can be either any one or the combination of more than one. First, production of inactivating enzymes like acetyltransferase. Example, Haemophilus influenza, Staphylococcus aureus, and Salmonella typhi. Second, decreased permeability to the microbial cell wall. Third, ribosomal mutation. Now let's see the antimicrobial spectrum of chloramphenicol. Chloramphenicol is primarily bacteriostatic in nature, though at higher concentration it may also show bactericidal effect in some bacteria like Haemophilus influenzae and Neisseria meningitis. It is a broad spectrum antibiotic just like tetracyclines, and it has nearly the same range of organisms, that is gram-positive and negative cocci, bacilli, rickettsia, and mycoplasma. The noticeable differences between chloramphenicol and tetracycline are that chloramphenicol was highly active against Salmonella, including Salmonella typhi, but resistant strains are now rampant. It is more active than tetracyclines against Haemophilus influenzae, B. pertussis, Klebsiella, Neisseria meningitis, and anaerobes, including B. fragilis. It is less active against gram-positive cocci and spirochetes, while Chlamydia, Entamoeba, and Plasmodia are not inhibited. Like tetracyclines, it is ineffective against Mycobacteria, Pseudomonas, and Proteus, virus, and fungi. Now let's see the pharmacokinetics of chloramphenicol. Chloramphenicol is commonly given by oral route and is rapidly absorbed through the gut. It is also available for parenteral and topical administration. It has a bitter taste. To improve the taste, chloramphenicol palmitate suspension has been developed for pediatric use. It gets activated in the intestine by pancreatic lipase. Chloramphenicol is widely distributed to all tissues including cerebrospinal fluid and brain. It also crosses placental barrier and is secreted in milk. It gets metabolized in liver by glucuronide conjugation, and the metabolite is excreted mainly in urine. Now let's see the adverse effects of chloramphenicol. Chloramphenicol produces hypersensitivity reaction like skin rashes, drug fever, and angioedema may occur rarely. It is responsible for bone marrow suppression. It is the most serious adverse effect of chloramphenicol. It can occur in two ways. First, dose-dependent reversible suppression of bone marrow, which manifests as anemia, leukopenia, and thrombocytopenia. Second, idiosyncratic non-dose related irreversible aplastic anemia, which is often fatal. Chloramphenicol produces gastrointestinal effects including nausea, vomiting, diarrhea. Prolonged use may cause superinfection due to suppression of gut flora. The characteristic adverse effect of chloramphenicol is grey baby syndrome. In neonates, especially in premature babies, chloramphenicol can cause a dose-related grey baby syndrome due to reduced degradation and detoxification of the drug in liver. because of the deficiency of glucuronide transferase enzyme. The manifestations are nausea, vomiting, abdominal distension, diarrhea, refusal to suck, cyanosis, irritability, and circulatory collapse. The skin appears ashen grey color, hence the name grey baby syndrome. Mortality is high, therefore chloramphenicol should be avoided in neonates. Here you can have a look on the images of grey baby syndrome and hypersensitivity. Drug interactions. Chloramphenicol is an enzyme inhibitor. So, like erythromycin, chloramphenicol increases plasma concentration of certain drugs such as warfarin, phenytoin, rifabutin, and antiretroviral protease inhibitors by inhibiting hepatic cytochrome P450 isoenzymes. Now let's discuss the therapeutic uses of chloramphenicol. Chloramphenicol is used in typhoid fever. It was the first drug of choice for typhoid. Antibiotics useful in typhoid are third-generation cephalosporins, fluoroquinolones, azithromycins, ampicillin, cotrimoxazole, etc. Now, fluoroquinolones or third-generation cephalosporins are the drug of choice for typhoid fever. The dose for ciprofloxacin is 750 mg 12 hourly for 10 days. It also eliminates carrier state. Multi-drug resistant cases are treated with ceftriaxone or azithromycin. Chloramphenicol is used in bacterial meningitis. It can be used alone or in combination with ampicillin. Third-generation cephalosporins are preferred drug for the treatment of bacterial meningitis, but chloramphenicol can also be used. Chloramphenicol is used in anaerobic infections. It is effective against most anaerobic bacteria including B. fragilis. It is often used in combination with metronidazole for the treatment of brain, lung, intra-abdominal or pelvic abscesses. It is used in rickettsial infections. Generally, tetracyclines are the drug of choice for the treatment of rickettsial infections, but chloramphenicol can be used to treat it in children and pregnant women. Chloramphenicol is used in eye and ear infections. It is also used in brucellosis when tetracyclines are contraindicated. Thank you everyone. That is all for chloramphenicol. Hope you liked the session and you understood it. If you liked the video, then please share it with your friends and spread knowledge. Thank you.